Good evening, everyone. My name is Shubhangi Kichlu, and I'm the Associate Director of Growth at Codera. Thank you so much for joining us today as we delve into the details of COVID-19 support for India. I'd like to begin by wishing you and your families well. I know the current surge of the COVID-19 pandemic has impacted very many lives across the nation. Today, we would like to take a moment to look at the various opportunities for assisting the thousands of medical workers and nonprofit partners working tirelessly to end this pandemic. We will begin by looking at the COVID situation in India, then looking at the CSR law and amendments and understanding the changes that have happened there. We will also have a discussion with the principal scientific advisory team on demand and potential projects. And we'll also examine a couple of additional nonprofit projects as well. We will have a session with Kusum Makhija, Vice President Branding Communications and CSR at DBS, where we will discuss the virtual volunteering program and how that has adapted and changed over the last year. And we will spend a little bit of time talking particularly about virtual volunteering opportunities for COVID-19. I would also be open to an audience Q&A towards the end of the program, and we've reserved some time for that. So if you have any questions, do continue to share those through the Q&A, and our team will continue to answer some of these, and we'll pick a few questions for the audience Q&A towards the end. We have been in conversation with a number of companies who would like to commit CSR funds towards COVID-19. And there have been a range of questions which are largely grouped into these categories, looking at what is the need, where is the need in terms of COVID hotspots, but also in terms of which hospitals to get in touch with. And of course, we have to be cognizant of the fact that this is a constantly shifting situation. We've also had questions that have come in about how to channel funds to the right partners, as well as how all of this in terms of CSR, in terms of funding, fits within the compliance and CSR law. Looking at the state of COVID in India, it is well known that we've hit over 25 million or 2.5 crore cases. The table here ranks all of the states according to the current active cases, demonstrating where there are current requirements and the hierarchy of these. In comparison, the map here shows the daily cases that we have been seeing. And this is particularly for today and taken at 8 a.m. this morning. So you can see here that the highest number of new cases are being reported in Tamil Nadu, within Kerala, Karnataka, and Maharashtra. And that is really where the need seems to be at present. In terms of the how and why, let's take a moment to look at the CSR amendments to the law. Healthcare has been a key part of the CSR law at the very first iteration of Schedule 7. With the onset of the COVID crisis in 2020, inclusions were made to encourage companies to contribute towards action on COVID relief. These circulars and FAQs show the changing narrative of COVID in India, starting off with COVID-19 notified as a disaster and CSR funding being made available towards COVID relief in 23rd March 2020. The next notice that we saw came out in August, and this was when we saw an introduction of research and development for vaccines, drugs, medical supply being made a part of CSR spend for companies for whom this is not a normal course of business for the next 3 financial years. So these are largely looking at, for example, pharmaceutical companies. In January this year, there was also a change that allowed funds to be spent on awareness programs and public outreach campaigns regarding the COVID-19 vaccination drive, and to be classifying this as an activity for CSR funding as well. However, what is noted here is that activities benefiting solely employees of the organization continue not to qualify for CSR spend. So activities that look at community awareness, community outreach for vaccination camps, etc., would continue to be part of this as well. The latest additions have been in late April this year, where makeshift hospitals and temporary COVID-19 care facilities was set up with the state health departments, came under CSR funding as well. And the last portion has been very recent in May, where creating health infrastructure for COVID care, as well as the establishment of medical oxygen generation, storage plants, supply of oxygen concentrators, ventilators, cylinders, and other medical equipment and similar kind of projects also began to become a part of the CSR law as well. There were also two areas around FAQs that were released, which talked about eligibility for CSR. And these were looking at the PM CARES Fund and the State Disaster Management Authority, which came out last year, and ex gratia payments made to temporary workers, which all fell within eligible activities. What remained ineligible, of course, was the Chief Minister's Relief Fund, the payment of salaries and wages during the lockdown periods, and that would have otherwise been paid as well, and payments to casual or temporary workers that would have otherwise been paid as well. Moving on, we also wanted to take a moment here to address questions that have come in about the different ways of compliance and how companies can undertake projects here as well. The first option we have is for direct implementation, where we're looking at the hospitals, the supplier or the vendor being registered with the organization, that is the company, and being able to undertake direct implementation and structuring a project as that, which means registering them as a vendor for your company and making a direct donation towards equipments. And then, of course, making this available to the right kind of authorities who would then take that on. For example, state governments who are continuing to do that, or giving it to an NGO. The other option, of course, is through your existing NGO partners. And this is very useful if you already have their vendor onboarding concluded and their due diligence concluded. And the requirements here is just because of the change of that came in January, looking at CSR Form 1 for this financial year, ATGs existing or applied for this financial year, the 3-year track record, and any other due diligences that you have in place. So looking at those projects with existing partners is also a great idea to do. The next part is looking at a Section 8 company that can be set up by the company itself. And that looks at CSR Form 1 again, and a 3-year track record is not required in this case. And of course, a final piece where Pudara itself has tied up with a number of different partners in order to channel this kind of COVID relief projects. So if you do not have a nonprofit partner in place for any of the projects that we continue to discuss today, we have a number of different partners who are willing to channel those funds and get that across to the organizations who are actually running these projects on the ground as well. The circular we discussed in April focused on partnerships with state governments for makeshift hospitals and direct implementation, as well as partnerships with other corporates. Unfortunately, the circular did not present the direct contacts of these organizations, nor did it validate these projects and potential partnerships, which is why we have been collaborating with Invest India to introduce some of these key projects to companies. I'm going to briefly introduce our two speakers from the Principal Scientific Advisor to the Government of India office. We have with us today Ms. Aditi Lele, Member Industry Academia Engagement Group, Office of the Principal Scientific Advisor to the Government of India, and Mr. Vibhor Bansal as well. Vibhor is the Consultant, Office of the Principal Scientific Advisor to the Government of India. Aditi, Vibhor, if you could switch on your microphones and your video as well. I'll begin by raising a question to Aditi.
Hello.
Hi. Aditi, before we delve deeper into some of the projects, can you give us an overview of the work you have been doing in terms of collating demand across the various states and hospitals within India?
Sure. So we've been working quite closely with the state government officials, the health secretaries from different states across the nation, to know exactly where are the requirements for these kind of makeshift hospitals, as well as oxygen cylinders, concentrators, ventilators, and other medical equipments. And as per we receive the requirements, we've been trying to deploy these makeshift hospitals in those particular primary hospitals in different states.
Great. And what type of projects would you say are really the need of the hour in this second more critical wave?
Right. So as we all know, there's severe crunch of hospital beds all across the nation. And similarly, we are quite in demand for oxygen, medical oxygen supply everywhere. There's a need to ramp up manufacture and supply of these two things all across the nation. And that's why I think the Office of PSA has undertaken these projects of national importance, and we are working towards making this happen to provide all these things all across all the states in the nation.
Sure. So Aditi, corporates have come to us with an interest in funding projects such as the Medicabs, which I'm now displaying, where you set up makeshift hospitals. How are we ensuring these hospitals are well managed and resourced, are in place to deliver healthcare at these locations? And can you describe the project for us as well?
Sure. Before actually moving to description of this project, I would briefly like to tell all the participants here the kind of work that we are doing, our division, especially Industry Academia division. As the name suggests, we try to bring about collaborations between industry and our network of academic institutes. We have done quite a lot of projects, close to 200 such partnerships from the last year. And last year during COVID, we had brought about these partnerships uh, related to testing kits, PPE, mobile diagnostic labs, and things like that. And this year, during the second surge COVID rise, as mentioned, we have undertaken these three important projects. So one of them is this Medicabs. So this is a product developed by the startup called Modulus Housing. Medicabs is a portable container that can be easily quickly built and deployed to the location where it is required. Um, it can be a 20, 50 or 100 bedded facility. And just to give you an idea, a 100 bedded facility can be built in a duration of 3 weeks. So this is why we think that this is very much required at this time where we are struggling with a lot of crunch in hospital beds. So that's there. And if you ask about the sustainability, how do we make sure that? So this product is actually CD SEO certified. So this is a certification given to the medical equipment. So this is already prefabricated, and it's just a plug-in device. So it is completely made and delivered, and they just need a power supply, water supply, and oxygen supply from the main primary building. So that's how that portable container works, and it has different zones, including isolation zone and intensive care units, wherever the patients are required to be admitted in the ICUs. They have that kind of facility as well. Um, so yeah, so that's what we've been doing, and as mentioned earlier, we have identified the requirements from the state government, and accordingly, we are trying to get donors for this facility, for setting up this facility wherever they are required with the most.
Thank you. I'd really like to understand that in terms of, a lot of companies have come to us and says, how do we work to ensure this is a sustainable tool post COVID-19? Because they want to look at continuation of the project long term as well. So any thoughts around that?
Correct. So this product actually is quite durable. It has a durability of around 25 years. But and just to give you a context, they have also built this in Tata Memorial Hospital in Bihar, in Muzaffarpur. So that was built around the COVID time last year. The hospital used them as a COVID essential COVID facility at that time, and after that the wave was over, they converted it as a cancer facility. So now that hospital has become the largest cancer facility in Bihar. So it really depends on hospital. If they want to continue to keep that facility as their extension, they can do that for next 25 years. If not, then this facility can be easily dismantled and moved to a location, say rural areas or district hospitals or wherever it is required. It can also be negotiated at the time of the implementation, wherever the hospital wants it to be dismantled and moved, say after 5 years or after 2 years or so.
That's great. That's really useful to know for our teams as well. Vibhor, I'd like to now move to you and talk to you about, the outcry regarding the lack of oxygen within hospitals has been very intense. Can you describe to us the O2 project in detail and how effectively this can provide resources to all of the regions in need?
Yeah, so thanks, Subhangi. It's a pertinent question and the most important question in today's time. Thing is, till 3 months back, right, or maybe I would say till January, we did not require that much of an oxygen that we require now. And because this is because of the virus mutation and the change that has come along the way. Uh, these are very difficult scenarios because we never thought that the kind of oxygen need that we have today will be there. At that time, the whatever infrastructure we had at the state hospital level was sufficient, because that was a thing that is going on for decades, right? But suddenly, with this rise of oxygen, we realize that there are few things that needs to be done in the at the infrastructural level, and that is where the project O2 was launched. Most of the things that needs to generate oxygen are imported. It includes not only the final goods, but also the uh, raw material and components. The most sought after equipment was concentrator. Reason being, this is portable. This could have been placed anywhere at the bedside of the patient, and it is a plug and play device. The second thing that was that became very most sought after was a PSA plant. The PSA plant is actually oxygen generation system that is placed in the hospital, and oxygen can be then from the plant goes to the bedside, or to the or fill into the cylinder and supply to the patient bedside. These are the two things that we wanted to change. We wanted to change the reliance on the foreign imports, particularly Chinese import. And second, we also wanted to build an infrastructure within the country that stays longer. It is not only for today, it is or for these 2 months, 3 months, or say next three waves. It is for life, for any future such calamity. With that in mind, we came up with this project O2 and created a consortium, the national consortium of oxygen, which is comprising of the Institute of National Importance, all IITs like IIT Kanpur, Delhi, Hyderabad, Bombay, National Chemical Laboratories Incubation Center, Venture Center, and C Camp in Bangalore. So these are institutions who have been working in the areas of science and technology, in incubating lots of SME startups, working on new technologies. These are the institutions who have been instrumental in doing 56 new innovation last year during the COVID time, with the help of PSA's office. And these includes RT-PCR kits, as well as the some of the as basic as new age mask, PPE kits, etc. So with that consortium, we looked at where are the problems. Then we roped in raw material supplier. We roped in large manufacturers like BEL, like ECIL. We roped in technological know-how from these institutions. We have chemical experts from IITs. We have large manufacturing experts who are evaluating these companies to see that whether their proposals, their projects are good enough to be rolled out. We have large manufacturing infrastructure consulting firms like Tata Consulting Engineers, who can help in lots of things. So we created this consortium, all put together, sharing knowledge day in, day out. We started calling for proposals from the industry. Different SMEs came up with the newer ideas, with the existing technology based ideas, and now there are few proposals have been approved from this consortium that can be utilized in the country. And what they need is a support to scale up their existing manufacturing capacity, or developing the new manufacturing capability, so that they can scale at the rate which is required in the country. And that's about the project O2.
Thank you. Do you want to take us through some of the different programs that you have
So yeah,
in
I
terms
mean,
of the proposals?
we have listed four proposals here. For example, this one proposal is from this company Endima and their partners Camdist and eSpin. They were at IIT Kanpur. They were incubated with the help of IIT Kanpur and IIT Hyderabad, and they are making this oxygen concentrators at 5 to 8 lpm with up to 93 percent purity. They need help in terms of upscaling their manufacturing capability. Right now, they already have some orders. Like recently, we helped them close deal with the ONGC. You assume you must have seen that in the news as well. They've got some deal with the ONGC, and now they are trying to deliver as many. Second one is about the ventilator. This is a G1 light ventilator, and again another SME which is trying to build made in India ventilator, so that we have they have done it. They have already done it. They now need a manufacturing upscaling capabilities, and against which they are ready to give certain free of cost to their given hospitals. Another proposal is about, this is for plants. So the one of the generation plant which can build say 500 LPM capacity plant in a small hospital up to 100 bedded facility, and that can give required oxygen. They are also looking at they have got some orders, also going to expand. We are roping in more and more such suppliers in days to come, who can build these kind of plants and set up in the hospital. The next proposal is again of a concentrator who have, this startup has tried to convert one set of device into a concentrator, and that ways they just need help in terms of scale, tweaking their manufacturing assembly line in a way that suits the new requirement, and the proposal is accordingly like that. And the concentrator could be cheaper because they are tweaking the existing facilities to make it medical grade concentrator. So these are few of them. We have couple of more concentrator proposals who can be there. The consortium committee, evaluation committee meets every week, look at new proposals that come in. That goes to another expert committee who evaluate them on the manufacturing capability angles. And then it comes to us as an approved proposal, which we floated to the CSR organizations who can fund these proposals, say if fully, great, otherwise partially, and whatever out resulted products will be deployed at the government and charitable healthcare facilities.
That's really great to know. In fact, right now we're actually getting questions from the audience as well, particularly about this project. So one of the questions we're getting is, how would this be deployed? So in these cases, I'm guessing that the tie-up that you're looking for is going to be either directly with the incubator or directly with the nonprofit. Is that the case?
Yeah, so PSA office is only a catalyst and evangelist in all these all these projects. What if anybody is interested exploring more, they can connect with us, and we can help them reach out to these companies as well as the incubators. All of them are of national repute. Nobody can doubt their capabilities, and that's where you can see, like Aditi mentioned in the very first question, we get requests from the state partnerships, and that's where we also know where these things are required. We can help you map those according to your focus areas, or if you know, or if a CSR organization already know that where they would like to deploy, we can simply help them connect with these institutions and these SMEs, and they can work with them.
I think it's very important at this point to just take a step back. I know you've mentioned that some of these companies have already gotten orders, but the list that you have shared with me, and we're happy to share with everyone else, of just the hospitals across these states, I mean, that is a list that goes into hundreds, right? And that is really the scale of the demand that we're looking at. So while you are talking about this, is an absolute immediate need that is really required as well.
Yes, yes, and Shubhangi, I would again stress on the fact that immediate need, of course, we will address, but supporting these projects or these proposals will help these companies to establish in a way that will stay in the ecosystem, and we will be independent on the foreign imports, and that is a big relief for the economy as well.
Absolutely. And also it reduces risk for us as well. I also wanted to ask you a question here, and this has come up as well from many of our clients. So the projects that you're looking at supporting are born out of startups with the Government of India technology business incubators. But of course, they're a little hesitant maybe with the startup piece particularly. So what kind of guarantees do these TBIs and incubators bring in the maintenance and delivery of these projects?
So, a very good question. I mean, actually, I take it with a pinch of salt that we, in this country, we still take startups as with some, doubt. There has been some cases in past, but we are working with quality, right? As I mentioned, I named 7 institutions which we are working with. All these IITs and IIT Kanpur, Delhi, and they are all good track record holders, and these are not only startups. Please mind what I say is that these are all SMEs and large manufacturers as well, who did not have that kind of a technological know-how and the supply chain of materials. We are actually uh, enabling a few raw material and the component suppliers to make these components and these chemicals and raw materials of medical grade, right? So we are starting at that point. And then these SMEs, and some of these SMEs are of course fresh, new. They have come up with this idea right now, but these are not inexperienced startups or SMEs. They are the one who have been into the allied products and manufacturing. So for example, uh, somebody has already been working on ventilators and they moved to concentrators as well. Somebody who has been into the gas plants business or into the chemical based or gas based equipment manufacturing, and now they are also working, they want the technological know-how and tweaking the models to do these oxygen plants and things. People have been making nitrogen based plants. Now they're tweaking their models so that they can make it oxygen based plants. So these are not fresh companies. These are some of them are really well established players, and we are also working with the large manufacturers like BEL, ECIL, and their whole supply chain of 45 plus SMEs comes along with that. So it's a fairly strong consortium that is working towards this cause.
Thank you. I think it's great to know that. I'd also like to move into the last piece that we were going to discuss today about particular CSR projects, which is looking at the funding and research piece. Now, here we know that it's widely acknowledged that the only way to really move the population to safety is to look at from the very strains is to undertake vaccinations across the board. However, significant research still needs to be undertaken on the variability of responses to vaccines that have been currently delivered. So can you tell us a little bit about the kind of research that is being funded in this area as well?
So there are. This is one such example, I would say, which is in front of everybody through your presentation. We are doing at least 5 to 7 such researches. Okay, this particular research is about vaccine response, how vaccine is responding among the citizens. What are the effects, side effects, and the future effect of vaccine on the different variants and varieties of virus that are there and may come in the future. And similarly, surveillance, virus surveillance ecosystem for from wastewater sludge management facilities. We are also working on the genome sequencing researches. These all are researches again been happening at the accredited labs or the national repute in the country, like NCBS in Bangalore, CMC in Vellore, Pune Knowledge Clusters, and their partner institutions, which have been instrumental in identifying. Which has been instrumental in identifying the various variants of viruses. Their studies has been instrumental in developing various vaccines in past, like polio, like BCG, and others, right? So these are all like Dr. Gagandeep Kang, who is leading this particular study, is been instrumental in the polio vaccine and this variants and its particular variants over a period of time, over a few decades, right? And these kind of people are working on this study. This particular study is actually about monitoring our immune system, and then try to track the vaccine's response among human, and how the vaccine will work with the future variants. So we are looking at existing virus and its variants. We are trying to sequence it genomically through some other studies, and then that data comes in here to track how the variants are uh, changing, or how do we break the chain of different variants, and how do we make our vaccines more effective as we go along to the process. And these are these are not 1 day, 2 day, 1 month, 2 month study. These are the studies that will be conducted over a period of time across the country, pan India. These studies use some of the consumables which are very expensive in nature, and these studies are currently focusing on the highly concentrated cities like Pune, Vellore, Bangalore. But of course, the idea is to take them to nationwide. Currently, we are looking at about 80 crore of budgets for these 3-4 cities. But of course, as we go along, this budget, this is just a small piece of budget. This is just a beginning.
Thank you. That's a very detailed response onto what is really something that we need as a risk mitigation measure for the future as well. And I'm hoping
Yeah.
that based on all of the different projects we've discussed today, and I can see from the question set that we're getting that there is interest being generated and more corporates will be stepping up to fund these projects.
Thank you.
In
Thank you. And we
addition,
look forward to it. Yeah.
thank you. Thank you. In addition to these projects, we have also seen commendable projects with a range of nonprofits, which Gudera has collated. These range from oxygen donations, PPE kits for frontline workers, food kits and dry ration, oxygen concentrators, hospital beds, and manufacturing, as we've discussed as well. And of course, community vaccination drives in partnership with various hospitals, and supporting both awareness of vaccination as well, and looking at doctor consultation support and online consultation support and monitoring at home. So a range of these different activities across the board with different NGOs does lie with us. So if you do want to look at different kind of projects that you want to run through nonprofits particularly, do get in touch with us and we will be able to share that list with you. We really want to make as many projects possible at this stage and really work towards COVID relief as well. We will now move to our session on how virtual volunteering can make a significant impact during COVID-19. During the pandemic, we have seen a number of volunteers across social media contributing towards the COVID relief effort with a range of activities from their homes. Gudera has been working with companies to redefine virtual volunteering during the pandemic with a range of opportunities that support our communities. Before we delve into this, we will be joined by Kusum Makhija, Vice President, Branding Communications and CSR, DBS Asia, Hub 2. Good evening, Kusum. Can you hear us?
Hi, Shubhangi. Good evening, everyone. Thank you for having me around.
Thank you and welcome. So, Kusum, I really wanted you to kind of give us a brief overview of some of the strategies being undertaken by DBS to basically fight against COVID-19 at the moment.
Sure. So, like most corporates, I think we're also looking at COVID-19, the pandemic, holistically. One, from the employees' perspective in terms of how we support our own employees who are affected directly, indirectly with their family members. The other, of course, is the larger community, which is the charities we work with or the organizations that we work with. Local communities, since we're based in Hyderabad, the local communities in Hyderabad, the government hospitals, how do we sort of support some of the infrastructure requirements of those hospitals, whether it's oxygen concentrators, whether it's, oximeters and some of the other equipment. So it's basically sort of a two-pronged approach. And then we're also looking at the macro community of sorts. So we have a Give India sort of partnership where we're doing a fundraiser by employees for families and people impacted across India as part of the pandemic.
That's great to hear. So you've taken up a range of activities that we've discussed today as well. I really want to talk about particularly virtual volunteering. Now, DB has been undertaking this for some time. What drew the organization towards these opportunities, and how did you see your employees really contribute?
So volunteering is very intrinsic to sort of our DNA. We call ourselves a purposeful organization, and at the group level, right from our group CEO Piyush Gupta's mandate, we sort of look at volunteering as a like I said, an intrinsic part of our employee culture and employee behavior. So during the non-pandemic time, there was a lot of volunteering opportunities in terms of actually physically, visiting the beneficiaries, the communities. But since the pandemic struck, we decided to sort of now switch over to a virtual mode of volunteering where we interact with communities, through a virtual mode. We talk to, for example, a community of female students in outskirts of Hyderabad, sort of do a virtual mentoring of them. We call this entire movement as People of Purpose, POP as I call it. So this entire POP movement has been around for the bank for a long time, but because of the pandemic, we had to obviously switch to a virtual mode of doing that. We've had our own shares of struggles with that in terms of, for example, a lot of times the communities that we work with do not have access to good internet. So how do you really create a community internet facility? You encourage students to, because we work in 3 areas of education, elderly, and entrepreneurship. So how do you really, and environment. So how do you really sort of bring people together, enable them to be able to virtually benefit from, the effort that your employees are trying to put in. But it is very, very common for our people. In fact, most of our business unit leads carry a target of ensuring that all employees in their business units sort of complete at least 2 full days of virtual volunteering through the year.
That's really great to hear. And it actually brings me to my next question, which is really about how you cultivate this culture of volunteering as part of the organization as well.
Yeah, so I think volunteering as a culture has always been part of DBS. Like I said, we pride ourselves in calling a purposeful organization. And there's this entire people movement of sorts in terms of POP. But virtually, it's been a bit of a challenge initially during the early days of pandemic to get people to do virtual volunteering. There were inhibitions on both sides. Employees were inhibited to sort of talk to people on video. For example, if you're doing visiting an elderly care center and you're going and distributing some nutrition kits to them, it's very easy for you to face-to-face go and interact with those people. Whereas when it started happening virtually, there were sort of inhibitions. So we had to sort of train our people, and then partners like Budera sort of came to our rescue, because you have good trained professionals who actually sort of made it easy for our employees. They kind of gave that kind of comfort to our employees by doing those, workshops and sessions. And then we also sort of changed our strategy a bit, in the sense that we now are looking at virtual volunteering from the point of view of being able to contribute something from home. So while you would earlier go and visit a community organization, an NGO, or a charity organization. Now what we're trying to do is curate activities which are fun, which are interesting for people to participate in, which are also fun for them to learn, for their kids to learn. In fact, lately we've seen a lot of family members getting involved in our activities, and then do something for them. Maybe build, for example, a database, record a video message, curate a set of questions. So it kind of becomes a bit of fun as well as learning for the employees. So that's kind of has helped us generate some interest, and also being able to reach out to the communities that we want to reach out to.
I think that's really interesting. I love how you've really transformed it, and you've brought in the families as well and made it like a community exercise that you're doing together with everybody at the home. That really makes a real transformation in you looking forward to that time together as well and respecting it very differently. So I also wanted to mention that, Gudera has worked on a range of volunteering initiatives, including healthcare support, sourcing, community telewarriors, which we're bringing in, and resource validation. Do you think an approach like bringing this to virtual volunteering would enhance the ability of volunteers to take part in these sort of initiatives?
I most certainly think it's very important now to look at volunteering from the perspective of the impact and the ROI sort of approach. The amount of time and effort that you really spent in attending a session should just not be for fun and learning. Of course, fun and learning is a part of it. That's what makes it interesting. But also, how do you really sort of measure the impact in terms of number of people that you reach out to, number of people that you're able to help? So some of the initiatives that could be specific to COVID care, giving support to people who are directly, indirectly affected by a pandemic, would be definitely a good approach to look at. I mean, I remember last year in the early, I think April, March time frame, when the lockdown was had just begun, we started doing virtual sessions where we were teaching employees how to make masks and paper bags to distribute to their house helps, to the vendors in their society and people around them, so that they could be protected, and also drive the whole agenda around sustainability, which is also one of the key pillars of being a purposeful organization for DBS. So similar activities like this, which you can do remotely, virtually, but still sort of be able to make that relevant impact on the community, I think would be very, very helpful.
Yeah, I think that kind of draws on what you were saying earlier about working, we're trying to do engagements which have been successful, especially when you have challenges of working virtually, especially internet issues, etc. So what kind of activities do you think really worked well? Is it just the kind of the resource development or the making masks kind of activity, or any others that really stood out for you?
I think so far, learning-based activities, for example, learning sign language and recording a session for the hearing impaired, recording a message for those who are hearing impaired, mask making, of course, and then we did a few workshops around zero food wastage, because that's another area that we're very, very passionate about as an organization. So those things really worked. In terms of participation, in terms of engagement, in terms of families and kids being participative, also, from the employee's perspective. We tried doing mentoring virtually, but there were challenges, like I was mentioning earlier, to students, to underprivileged kids, to especially female students. But there we were challenged by language, we were challenged by the technology connections and everything. But I think now, probably, given that we are 1 year down the line, we have our share of learnings. We also know that the pandemic, unfortunately, is here to stay, at least for this year. Fingers crossed, it sort of goes away quickly with all the vaccinations and all the other things that are happening. But honestly, I mean, practically, we know that 2021 is going to be a challenging year for us. So probably now is the time to look at what we can do differently in terms of impact. For example, can we do activities for COVID patients to make them feel better, to interact with them, to look at doing some workshops where we help them relieve their stress, relieve their anxiety, maybe work with the experts to create an information toolkit for elderly who probably don't know how to deal with the situation when they or somebody in their direct contact gets impacted by the pandemic. So those kind of things, I think, would probably now be more relevant and more impactful from an employee's perspective as well.
That's really great to hear. And I was just going to ask you about what next for DBS virtual volunteering, but you've really answered the questions there. So thank you so much for joining us. And I think this is a great opportunity for us to examine some of the new virtual volunteering opportunities Gudera has collected with our partners. And these are some of the opportunities, of course, you and all of our corporate clients can also consider undertaking as well. So we're looking at everything with helping the community by working as a tele warrior as well. And here we will be volunteers will be trained to receive calls from the local community members who have COVID-19 related queries, and they'll be assisting them in getting their problems and their associated questions solved as well. And again, these are like short-term activities, but we're looking at repeat volunteers as well. Then, of course, there is the healthcare support finder, which has been something that people have been doing offline or have been doing through social media as well. And here, volunteers will be assisting in preparing a list of verified contacts, identifying essential requirements for COVID-19 patients, and calling and verifying leads. There's also been a great need for validating data, and I'm sure you've all seen this as well, where you've kind of looked at something on a message board and then realized that by the time you come to actually requiring it, it is already outdated. So there is a lot of need for volunteers who are validating data for COVID-19 resources and validating their authenticity, helping publish helpline numbers and getting them across in a timely manner. And this is a slightly longer duration activity that we're looking at. We're also looking at COVID-19 prevention kits for patients and households. So again, this is an activity where you're not looking so much at requiring a high internet connectivity, but it's something that you can do hands-on as well. So these kits will be distributed to COVID-19 households or patients therein who take precautions and help them stay strong and stay safe during this time as well. We're also working on projects where we're assembling ration kits for COVID-19 affected households as well. And these are especially for those who are not able to step out of their home at this time and go out to buy ration or whatever else is. And these kits are really going to work to help them overcome this tough time for them. And we're also looking at wellness kits for frontline workers particularly. And there has been a significant impact on frontline workers who've been dealing with the pandemic for well over a year now. And it has obviously had a real impact in terms of mental health as well. So creating these kind of wellness kits is something that we want to do as part of volunteering to help show our love and our support to all of these frontline warriors. The other people that we're kind of looking at volunteering with is, of course, rural children, and we're creating all of these flashcards in local languages, which will help the rural underprivileged understand more information about COVID-19 in local languages. And I think you already heard today that language really is a barrier sometimes in some of these communities. So bringing that information that is so readily available to us, to all of these communities, is a key part of making sure that all of our more rural communities remain COVID-free. And recording audio content to also manage health. So this is audio content that is being recorded for underprivileged women to manage their own healthcare during COVID-19. And this is to help them receive structured information about the disease, particularly for those who would not have great literacy levels. For them to receive content often in an audio format is a much better way of sharing this as well. So, and the last kind of thing that we're looking at is helping increase vaccination in vaccine hesitant communities as well. So here volunteers are going to be helping NGOs work with providing information, assistance, updates about where vaccines are possible, and to help create these vaccine drives as well in their communities, in other communities as well, and drive the agenda of making sure that everyone does get a vaccination very quickly in time. So we have concluded a little on time in terms of the conversations that we've been having, and we are now open to some Q&A questions. So if you have shared any questions with us, this will be the time to do so if you want to add any more questions. I think in terms of, we've just received a question from Pratima as well on assembling activities. Are these being done at a particular site or volunteers assemble these at home? Pratima, these are created as kits that volunteers assemble at their homes and made available to them. There are also a list of things that we actually send out to volunteers that should be part of kits as well, so that they can prepare this, join a volunteering session, and then actually go ahead and create the kits during that session as well. So there's a number of different things that we can look at doing and supporting employees with as well. I think we've already discussed the kind of engagements that have been successful considering internet issues and challenges virtually. So any kind of activities that are hands-on activities that can be led by an instructor virtually, but also come with a set of instructions that you can continue to do at home and also continue to do with your family as well are really encouraged as well. We're also looking at some of the earlier questions as well that we've had. In terms of setting up extension hospitals in different locations, again, if you do have requirements, please do get in touch with us. We are sharing a lot of information with different entities who are gathering these resources together and putting them together. So we would be happy to kind of share any of the requirements that you are having with all of the agencies, such as our team from the Principal Scientific Advisory, who are putting together all of these demand lists. And we are maintaining our own demand list internally as well, which we are sharing on a frequent basis with our clients who are interested in undertaking projects at different locations. In terms of undertaking volunteering as a foundation, we do have a volunteering sourcing team as well. If you would like to get in touch with us, we will put you through to the team as well. They will help you generate a kind of volunteering program for your organization as well, so that you can reach out to the volunteers that we have from our corporate team as well. So I think that's another question from Kajal. And I think that is largely most of the questions that we have looked at. We've had similar questions also looking at areas about managing the supply and of doctors and nurses for these hospitals. Aditi, if you are still here as well, it would be great if you could help us answer this question, because I think in the Medicap project, one thing Subha would like to clarify as well is in terms of managing the supply of doctors and nurses for the makeshift hospitals, how would we be undertaking that?
Right. So when we identify the requirements from the hospital, we make sure that they know that they have that kind of resources available to undertake the extension hospitals. So currently the starter model is housing that is working on 7 projects right now. They have a formal letter from the hospitals that they will be supplying the resources to the extension hospitals that are being implemented.
Great. So there is what Aditi is saying in conclusion, I'd just like to sum up again, is that there is a main hospital who is providing the services to the extension hospital. So it will be led by another team as well to make sure that those kind of resources are made available. And it is a successful deployment as well.
Right.
Great. Thank you. There was also another question here, Aditi, about the supply of medications to this. And I think this is also taken care of as part of the extension hospitals as well.
About the medication, supply of
Yes.
medication to the extension hospitals?
Yes.
Yeah, so that will also be taken care by the hospitals, the primary hospitals themselves.
Great. Okay. We also have a couple of questions around tying up with Ngo Partners, etc. So as we've said earlier, depending on the nature of the project, you could tie up directly with the different agencies and the incubators undertaking these. They already have registration for ATG and all the other due diligences in place. They've completed their CSR Form 1 in most cases. We can validate these for you as well. And so do get in touch with us, and you can work with them directly, or you can do it as direct implementation and register them as a vendor, whatever suits. Or if you are looking for another nonprofit to kind of channel those funds through, that is also an option. And again, we can put you in touch with nonprofits that are also working towards that as well. I think that is largely it for our questions today. And I think we are good to take a moment and conclude here. So if you do have any more questions, please do reach out to me. We will be sending an emailer to all of the participants as well. And we will make sure that you have access to the questions and the recording from today in the near future as well. Thank you so much for your time, and thank you for joining in.